my name is Bowen, CEO of Northwestern Medical Center, and your host of the new NMC Health Beat Show, dedicated to discussing hot healthcare topics. Our goal is to provide you with some great education on available services and help you become a more informed consumer of healthcare. With healthcare reform upon us, there are challenges and opportunities to face as a community. In partnership with community providers, we take great pride in serving Franklin and Grand Isle counties and want to be your trusted healthcare resource. Today, we welcome Dr. Ryan Kirwan and Caryn Burleson from Northwestern Medical Center. Dr. Kirwan started at NMC in April of 2013. He is a board-certified radiologist who studied at McGill University in Montreal with a fellowship in breast imaging. Caryn Burleson is a radiology technologist who specializes in mammograms, and she's been with NMC for 20 years. They're here today to talk with us about mammograms, as October is Breast Cancer Awareness Month. So, Dr. Kirwan and Caryn, thank you so much for being here with us today.
Thank you.
And I'm so excited to talk about mammograms, but I first have to mention you have a very nice tie on for this session. So that's great, and Caryn is wearing her breast cancer outfit as well for her work. So let's talk about October, and what is it about pink? What's happening in the month of October?
So October has become synonymous with pink and Breast Cancer Awareness Month, and the reason for that is because breast cancer is a common disease. 1 in 8 women will develop breast cancer in their lifetime. It's second only to skin cancer in terms of number of cancers diagnosed in women in the United States. So the month of October, we really like to get people's awareness about breast cancer heightened and make women aware of what they can do to help prevent breast cancer from controlling their lives.
Great. That's a great explanation. Now, Caryn's going to give us a little bit different twist, though, because pink in October means something different for you. I understand your hair is not going to be as long as it is today.
No, it will not.
Oh, what's going on?
Well, my hair is naturally curly, and this is the longest it has been in 15 years. So I have decided to donate my hair. I've asked my coworkers at NMC to help support that by donating. So they are donating money to a cut and color. There are 3 different cuts and colors that are options, and they are supporting their money into the cut and color they would like to see.
Oh, boy.
So the surprise for me will also be I have the where and the whom is cutting my hair.
Oh, okay.
I don't want the information shared as to when and which cut. So that is part of the, I think, surprise that women receive when they get the diagnosis of breast cancer.
Right.
They don't know when it will happen, how it will happen. They don't know where and whom either. So it is to help support them in their fight.
Wow. So, I mean, it's fun, but it's really about an awareness as well. So let's talk about mammograms and when is the right time. There's some differing opinions, I think, on when is the right time to have a mammogram. And then maybe if one of you could talk about what is a mammogram, how is it done, because there's definitely fear around it as well. So let's really get into the discussion about when and what it's like.
So first of all, the when to have a mammogram. Before 2009 in the United States, there was fairly uniform agreement that all women should start having a mammogram at age 40 and continue every year thereafter. Now, this is a woman in the general population. Some women have higher risk for breast cancer, and if you think you may be one of those people, certainly talk to your doctor, because some women do qualify for mammograms starting before the age of 40. But in the general population, the consensus was that women should start at age 40 and continue every year thereafter. Now, in 2009, there was a study by the United States Preventive Service Task Force that got a lot of press, and that changed the recommendations to starting at age 50 and only doing it every other year until age 74. There's a lot of controversy about which recommendations should be followed, and in the literature every month there's new articles coming out with different recommendations, some of them favoring every year starting at age 40, some of them even favoring more aggressive techniques with better technology. Others are on the other side of the argument, and those go as far to say, some studies even suggest that screening mammography should not be performed. So unfortunately, this has created a lot of confusion in the public's eye, and also amongst many doctors as well. And unfortunately, not all studies are based on solid science. And also, unfortunately, there are other influences in these studies, being financial factors, political factors, which we just can't get away from. So it's a difficult question to answer, and each doctor that you ask will probably have a different opinion. Personally, I still follow the American Cancer Society guidelines, which are the old recommendations, starting at age 40 and continuing every year thereafter as long as you're healthy. But you will find other doctors who will believe that every other year is adequate. And yeah, unfortunately, there is no true consensus on that right now. Part of the decision has to be what the patient is comfortable with, and knowing that by having a mammogram every other year, there is more risk that if a cancer develops, it has more time to spread. But we have no definitive answer. There is information out there if people want to look into it further and take it upon themselves to learn more about this topic. And the American Cancer Society does have a lot of good, reliable information on their website regarding breast cancer. And as with any healthcare decision, one's primary care doctor is a great resource to turn to, and that should be a very good starting point for people as well.
That's great. Yeah, definitely having a primary care provider and as an excellent resource. So Caryn, you actually perform the exam, right? The test. So what is it like, and can you take away some of the fears? You know, is it painful, but how does it actually work? And maybe even response, you probably have some patients that come in and have questions. So tell us what it's like to have a mammogram.
Well, we actually schedule a screening mammogram. We have those appointments scheduled every 20 minutes. So it does let you know exactly, it's a good start base as to how short our mammogram is. So there is some paperwork that is filled out on a yearly basis to help the radiologists gain more information on genetics and risk factors, yes.
Sure.
And the exam itself. So you are asked to undress from the waist up. You are asked to remove any powders or deodorants because they actually have ingredients in it that may show up on a mammogram.
Okay.
And those ingredients can mimic findings in a mammogram that would bring the radiologist's awareness to that area. So we do ask the women if they have worn those in to wipe down. The exam itself is maybe 10 minutes. Okay. So compression is we try to do to the patient's tolerance.
Okay.
There is a certain amount of pressure we are looking for so the skin of the breast is taut. But we have lots of clients come in. They have fibromyalgia, they have MS, and their tolerance may be lower than others. So we ask for good communication between the patient and ourselves, and we do try to make you relax during the exam because that does help out getting good compression. The compression stays down for 10 seconds and then the paddle automatically releases. In addition to that, on the top of the plate where the imaging is done, there's a soft pad that we use, and it separates the breast tissue from the cold parts, most of the cold parts of the machine, and it also wraps around an edge of the plate that is it's a little bit hard to come in contact with a rib cage. So with that padding, we've actually noticed that women allow us to image more breast tissue, and they stay more comfortable during the exam.
Great, thank you. Now, when you have the exam, sometimes there is repeats, and I know that makes us nervous if that happens. So what is that cycle of, and as far as getting that extra exam? And so how can you bring some comfort and reassurance to folks?
So as you mentioned, Jill, there is a lot of anxiety with these studies, and most people do have a family member or know somebody who's had breast cancer, so that increases anxiety levels. And so I'd just like to explain part of the recall here and how often that occurs. So about 8% of people who have a mammogram will get recalled. So just to put that in perspective, if we do 1,000 screening mammograms, 80 people are going to get called back. And those 80 people are probably going to have a very, very high concern when they're coming back and have to get extra mammographic images and or an ultrasound. But it should be known that on that screening study, we just get a general overview of the breast, and if there is any area of concern, we bring people back to take a closer look at that area. Most of the time, that won't be a cancer. In fact, if we look at those 80 people that came back, on average, only 5 of them are actually going to have a breast cancer. So the low numbers that actually have breast cancer based on those recalls should be a little bit reassuring. And the other thing that patients should think about is if there is a breast cancer, that's when we want to catch it. We want to catch it when it's early, before it's spread, when the treatment is much easier and much more reliable.
Great. So what happens if you do find a cancer? Is there an immediate follow-up? I'm just worried about the time between detection and the anxiety of getting something treated.
Yep. So after somebody gets called back from that initial mammogram, they come in again, and as I mentioned before, we'll do extra mammographic images, and sometimes we'll do an ultrasound as well. If we do find something that requires a biopsy, then they get scheduled for that biopsy. Now, some people can have the biopsy faster than others, depending on if they're on blood thinners or have other health issues. But we are very, very considerate of the time frame, and we try to get people in as fast as we can. There certainly is a little bit of a time process throughout all these steps, and even after we do the biopsy, when we have the tissue in our hand or on the table, we still can't say whether it's a cancer definitively at that point. The tissue needs to be stained, which takes some time, and looked at under the microscope. So even on the day of the biopsy, there is still a little bit of a waiting game at that point.
Great. Well, thank you so much, and actually thank both of you to be here to talk about mammograms and the importance of it. And I know that I have my mammogram, and I am asking that all the women out there, 40 years and older, right? That's the trigger. That I know there's a little bit difference, but we'll start with 40. Please get your mammogram. It is really about your health. So thank you. I'm Jill Bowen, the CEO of Northwestern Medical Center. And thank you for joining NMC Health Beat.